Hi, welcome back to Drunken Medicine, where we are drunk on medicine and passionate about whiskey. Ha! See, I didn't screw it
You
up.
did it. You did
Hi.
it.
So, I'm Ash. I'm a naturopathic physician, 13 years of experience. I mostly help people with hormone issues now and gut issues, some pain management as well, but I'll do a little bit of everything. But those are the things I really enjoy seeing. So, Mike, tell us about yourself.
So I'm an acupuncturist that's been practicing for a darn long time, over a decade. And yeah, I treat pain, I treat hormone issues, I treat what we're talking about today, which we'll get into. I treat basically anything that people have been dealing with for a while that they need help with. You got issues, I got solutions. So
Ha! I like it. That sounds like a pitch. All right, Mike. What are you drinking today?
oh, I got something new. I'm excited. It came in the mail today. This is Bunnahabhain, which I love Bunnahabhain.
You have the
It's
weirdest names. Yeah.
It's an Isla Scotch, and I'm gonna try to not butcher it. It's Bunnahabhain Stúrador, and it's Gaelic for helmsman, and it's a sherry Isla Scotch. So
Mm,
it's got that ocean flavor and smell, but in
yeah.
sherry casks, so it's also sweet.
You like the sherries.
I do. I like sherry. It's nice because it adds sweetness and complexity, especially when you have the really strong scotches that I drink. They're really medicinal and powerful. The
Yeah.
sweet really tones it down.
Yeah. Yeah. That's like me with bourbons. I love the rum
Ooh,
finished bourbons.
I like that.
Just 'cause you've got that little bite to begin with, and it's nice and smooth at the end.
Yeah,
Kind of just a little note of sweetness, so it's really nice to drink neat without anything else to it. So,
man, this reminds me almost of a bourbon. You were talking about bourbons, like it
mhm.
has that oak, like yeah, like a sherried bourbon is what it tastes like.
Okay,
It doesn't taste like a scotch. It's really good.
nice, nice.
It's delicious. What are
So
you drinking?
yeah, I'm drinking this Belton Bridge bourbon whiskey. This is a local here in Montana. It's really nice. It's from Glacier Distillery, which is just a few miles away. It's close to Glacier National Park. Um, I actually went there, I don't know, maybe 3 weeks ago. It's when I got this bottle, had a little tasting, and this is the one I enjoyed. But they make a lot of good different types of whiskeys there. I
Do they
think they
use
make some,
that water there?
I believe they actually do. Yeah.
Yeah, makes a big difference. The water you use makes all the difference. So it's
Yeah.
interesting.
It really does. I mean, I've literally sampled bourbons and whiskeys from all over the country. And I can tell you, like, if they're using, their own water, it makes a huge difference. I mean, this is just the water in Kentucky and Tennessee versus you know, sort of the East Coast. If you're like on the east side of like Virginia, North Carolina, South Carolina, I mean, the water's a little different.
Yeah.
It's not that limestone. It's not that kind of. I don't know. It just there's a I don't know. There's just like a cleanness to it almost.
It
It's
makes sense because the mineral content and everything, and like because
yeah,
it's made from that water, it makes complete sense. It would affect everything. I mean, that's what the
yeah,
Irish talk about with what they make, and then with Guinness, that's the big thing with Guinness is they say that one of the biggest things with Guinness is the water they use because it's water you
yeah,
can't get anywhere else except for there.
right, yeah, yeah. Yeah, I'm a believer for sure. But yeah, I really
Man,
enjoyed this one. I've just drank it neat because it's such a good tasting bourbon that I don't really want to have to use it in mixed drinks, things like that. You get your lower level, whiskeys or bourbons or like your rye. For me, the rye whiskey, which I don't like drinking neat, but I'll put in a mixed drink, like
yeah,
uh, uh, what is it, old fashioned or Moscow Mule or something like that.
yeah, I like Manhattans a lot for mixing
Yeah,
things.
yeah. Cool. All right, man. So today we are talking about arthritis.
Woo, this is gonna be good.
Yeah, yeah. So this is it's a pretty popular one. It's one that I think affects a lot of people. And I was curious. I did this years ago, and I'm just kind of looking through like the statistics and everything, especially when I was doing a ton of physical medicine in my practice. I always try to stay on top of just how prevalent certain things are. And we're talking about arthritis. So I went ahead and looked up some more recent numbers on arthritis. And oh man, it's significant. So according to the CDC, about 24% of all adults, that's 58.5 million people, have arthritis. Now there's
Wow.
different types of arthritis. Most of what we're going to talk about today is osteoarthritis, which makes up the majority of the cases. But you've got rheumatoid arthritis, you've got gout and pseudo gout and other types of arthritis out there, but that the osteo makes up the biggest majority of it.
The
Um,
gout.
yeah, the gout, disease of the kings. Um, the thing that shocked me the most is it's still to this day the leading cause of work disability, and annual costs for medical care and lost earnings equal about $303.5 billion per year. That's
That's
with a B.
crazy.
Yeah, yeah,
I would have never figured, but it makes sense. I mean, when I was doing my research, this has been talked about in Chinese medicine for 2,000 years. This is one of the
really.
oldest conditions that was talked about in Chinese medicine was arthritis.
Yeah, that makes sense. You can see the effects of arthritis, right? You can feel them. You can see sort of the joint hypertrophy occur.
Yeah.
I get that. Okay.
Yeah, but it's kind of cool that, it's mentioned in old books. Name doctors. You were talking about name doctors the other day, like doctors with names. Everybody has to know their name, and they name the conditions
Yeah.
after themselves and the points.
Yeah. Yeah. Right.
That's crazy, though. I didn't realize it affected so many people. That's wild.
Yeah. Yeah. It does. And we used to think that it was just a condition like osteoarthritis was just a condition of sort of wear and tear.
Yeah.
Like everybody is just going to wear it down over time. That's why we see it, progress, slowly progress as we get older. But we're now starting to understand that it's more of a metabolic condition than it is just straight, wear and tear. So, for instance, there was I pulled this up recently. This was really cool. The relationship between osteoarthritis and metabolic syndrome. So, metabolic syndrome, any syndrome that we're talking about, is usually a sort of a categorization of certain symptoms. And for metabolic syndrome, that it comprises of four main things: it's hypertension, so high blood pressure; hyperglycemia, so high blood sugar; dyslipidemia, which is high cholesterol; and then obesity. And what this study found, this was like over 7,700 participants, was they found that the metabolic syndrome was prevalent in 59% of patients with osteoarthritis. So they found this overlapping of metabolic syndrome with osteoarthritis in 60% of these people. That's a huge, that's a massive correlation there.
Yeah, that's a huge correlation.
Yeah. So we're seeing, and we see this a lot. It's like I've noticed, people that come in with, diabetes, especially like type 2 diabetes, they just tend to develop osteoarthritis at a much more significant rate and much more pronounced. So that their disability comes on much sooner, which makes sense too, because we do see a pretty high prevalence of osteoarthritis in people who are overweight or obese. I think it's like, let me see, 23% of overweight adults and 31% of obese adults have osteoarthritis. So, that's a pretty
That's anywhere. That's anywhere in the body.
That's anywhere. It's mostly going to be like weight bearing joints,
Yeah, that's what I was
knees,
wondering. Yeah.
hips, lower spine, places like that. That makes more sense. Like you've got a lot more weight on your frame, you're going to wear out joints, but also you've got the metabolic stuff that's underlying there, sort of the high blood sugar, increased inflammation, chronically for months, years at a time, high blood pressure, all that's going to contribute to that wear and tear just moving along at a greater rate.
And that's awesome. I mean, not awesome, but it's awesome that you mentioned that because it makes sense. When we get into, causes, you were talking about wear and tear, in Chinese medicine, overuse is a cause, but they also talk about diet, not enough exercise, like the same things we talk about every week. is what they talk about as a cause for this, which makes absolute sense of what you just said, being part of that.
Yeah. Yeah. So when we're talking about sort of root cause, like what causes arthritis, which obviously helps us determine what we're going to do about treatment strategies. Then if this is a metabolic condition, then again it goes back to doing all the healthy things that we talk about every episode, right? Except that I call it the core four of nutrition, movement, sleep, and stress management. Like those are kind of the core four aspects that I'm always working with everybody, no matter what condition they come in. But it seems even more important, I think, when we're talking about arthritis, just because of that significant metabolic connection.
Yeah, I mean, and that makes complete sense because, anything that I'm going to be working on with people, it's funny when people come with arthritis, they never think about lifestyle stuff. Like, I mean, that doesn't even come to their mind because they're like, I
Yeah,
have arthritis in my hip. Why are
yeah,
you telling me that I need to eat better and exercise? It hurts to exercise. Like, what are you talking about?
right.
It's not
Yeah,
something that people even think about.
yeah. Or it's a localized issue, right? Oh,
Yeah.
I have knee pain. Well, I'm not going to connect my knee pain to my gut health or my lack of sleep or my high stress or any of those other sort of more generalized sort of issues. But hey, maybe somebody who's listening to this will get that light bulb and start to connect the two together.
Absolutely. So in Chinese medicine, this is called painful obstruction syndrome, B syndrome, BI, and
Does it
painful
have
obstruction.
something to do with the kidneys?
Eventually, not in the beginning. Actually, not in the beginning. In the beginning, they actually saw it as an invasion of a pathogen because what they thought is,
hmm,
okay, it's worse. Certain kinds of, especially osteoarthritis, a lot of people get worse when it's really cold or if it's damp. Their
yeah,
arthritis feels worse. And so they thought, well, that means there has to be some kind of invasion of cold and damp that's actually, getting in your body and causing these issues. And so there's different types. There's wind, which is it moves around to different joints, which of
hmm,
course that's, we can talk about that for other types of arthritis. There's
yeah.
damp, which is more the stiffness. Like if it's very, very stiff, but not a lot of pain,
Okay.
whereas cold is the super painful, later osteoarthritis that just gets really, really painful and stiff. That would be
Hmm.
that cold damp. And then there's heat or hot. And that is, you know, red joint, red inflammation, swelling, which gout, would fall into that. Some
Yeah.
rheumatoid arthritis would fall into that. And
Right.
they lump it all together. Basically, all these things get lumped together. They would even probably lump tendonitis in with this as an obstruction,
Hmm.
psoriatic arthritis, rheumatoid arthritis. It would all get lumped in.
Yeah. Well, that will make sense. As a joint becomes more unstable, like with osteoarthritis, so you've got less space inside the joint. That joint becomes more unstable because you've got bone spurs and other things, mechanical issues going on. Now you're putting more pressure on the tendons that are around that joint, the ligaments around that joint. So you're going to see more tendinitises around that joint that's got a significant amount of osteoarthritis. So it totally makes sense in like our world too.
Yeah.
You're kind of saying the same thing.
And what's really interesting is, so most of the time, every week you hear me talk about different channels, kidney channel, liver channel, which you can't really put your finger on. Like you can't just scan the body and be like, oh, here's the liver channel, even though it does follow certain areas. This one is different. This is one of the few things that's very different because they look at it as it deals with underlying, like under the skin, but above the bones, basically. So muscle, sinew, fascia, tendon, like all that is where it kind of starts. So they
Yeah.
don't even look at channels in the beginning as much as this. It's called coulis. It's this connecting area where the muscles and the tendons are involved. And
Ooh.
so it's very
I,
different.
I wonder if that's just another name for fascia.
Yeah, I think it is because it's under the
Yeah.
skin and above, above the other structures. I think it's fascia because fascia is huge in acupuncture.
Oh man, yeah. Fascia fascinates me now. I wish I could go back to like med school in like dissection lab, because fascia then was just something that we had to cut away to get to the good stuff, right? To get to the muscles and the nerves and all that. And so we didn't really pay much attention to it. But now there's all this research about, what the fascia does. It's like this information highway. It's the way literally it connects everything from your brain down to your toes. And so now it's like we know there's so much more to fascia than
Mhm.
we ever understood before. So I'd love to go back and actually like dissect fascia out, because there's these thoughts that you can have what are called distortions, like fascial distortions, and there's different types. And sometimes you can see them on an ultrasound or imaging, but most of the time you can't. But we can kind of feel them, or if we work on them a certain way, we sort of elicit a certain response that's usually beneficial, reducing pain, inflammation, stuff like that. So we definitely know there's something going on there. We're not quite sure exactly what it is.
Yeah, and one of my favorite acupuncture studies was actually on fascia, because when you put in the acupuncture needle, you put it in and you actually go into the fascia layer and you twist, right?
Mhm.
And that's tonifying, reducing in Chinese medicine. We can talk about that later. It's not relevant at this point. But what is relevant is, so you twist the needle back and forth like this.
Mhm.
And so you always did it because that's what you're supposed to do for 2,000 years. It's just what they said to do. So they did this study, though, and they found that when you're doing this, you're actually wrapping bits of fascia around the needle, and you're creating a mechanical signal up and down this highway, this information highway. So you're literally affecting distal areas, like faraway areas, from
Yeah.
just stimulating the fascia.
Yeah. Oh, interesting.
Yeah,
So it's kind
super
of like
cool.
this, it's along the same lines as sort of anatomy trains, where this could be like part of refer pain patterns and stuff like that.
Yeah, yeah, it's just
Yeah.
super cool. So, because a lot of the question is, outside of channel theory, how are you affecting different parts of the body with acupuncture? And I think that starts to tap into one of the things you're doing when it's not along a nerve, because sometimes you're needling and it's along a nerve and it kind of makes sense. But
Yeah.
sometimes you're in the fascia itself and there's no nerves anywhere around, and it still makes sense because you're stimulating the needle. Anyways, that's
Yeah.
off track, but it's super cool.
Oh no, that's super. I like the tangent. That's really fascinating. Like I said, I think we could talk a whole episode just on fascia, um, and just some of the implications of what we do know, and some of the issues that can come about with fascia.
But it is relevant to this conversation too, because,
Yeah.
you can affect different parts of the body. When you have inflammation, it's going to affect the fascia. It's going to affect everything. And when
Sure.
you have
Yeah.
arthritis, you're going to have inflammation. So we could tie it back in.
Yeah. Okay. All right. We'll put that in the timeline there to do it at some point. All
Absolutely.
right.
I would
So
love to.
yeah. So we talked about the sort of metabolic issues around arthritis. Let's talk about some of the structural stuff. So
Mhm.
I think this is another big part of what I kind of review with patients, because most everybody, I'd say the vast majority, if I had to put a number on it, 75% or more people that come in have some type of pain going on. It could be mild to moderate, it could be severe, but they've got something going on. If you're over the age of 25, 30, you probably got a few aches and pains here, and they're probably musculoskeletal. Um, but what I'm finding is that age is probably getting younger and younger because of just how we work now, sitting for most of the day instead of moving. So a
Yeah.
lot of this is structure related, right? So if we're sitting, we have poor posture. If we're driving around a lot, we tend to jet our neck forward, our head forward, our shoulders slouch forward, our pelvis, posteriorly rotates. We're shortening those posterior muscles in the back, which are supposed to be our stiffening muscles, right? It's like when
Mhm.
you go down to do a deadlift, pick something up, your hamstrings stiffen up to allow you to be able to do that. Well, when they're shortened all day, it affects the strength of those hamstrings and other muscles. Anyway, so a big part of what I do is just help people move better and improve their posture, because this slouch posture for years and decades is putting an immense amount of pressure on certain areas of their spine. So it's going to be lower neck usually. So we're going to see osteoarthritis form at the base of the neck at the top of the thoracic spine, earlier than the other segments. The same with your lower lumbar spine because of that pelvic tilt. Posteriorly, you put a lot of pressure on the lower segments of the spine, like L4, L5, S1. And again, those are segments that degenerate, typically faster. And it's just all part of that, when you're changing the curvature of the spine, those curves exist for a reason. They're there to equally distribute the weight of your frame on your spine. So anytime you're changing the dynamic of that curve, you're changing the degree of that curve, you're straightening that curve out. Obviously, it's going to affect the amount of pressure each segment is placed on. So the lower cervical, the lower lumbar, those are areas that are going to have now more pressure being placed on them due to that change in the curvature of your spine.
Now, does that have anything to do with when people get the big knob at their lower neck, or is that something different?
Yeah, I mean, part of that's metabolic too. There's like Cushing's disease, which is an adrenal disease, can do that, where you get the fat pad back there. But no, oftentimes as people get older and their head is so far forward, those, oftentimes with osteoarthritis, you're going to see a hypertrophy of the joint, right? Of the bones around that joint because of that pressure. So you're going to see a more enhanced view of like their T1, C7, C6 segments because of that.
I was just curious. I see that a lot in patients in general, is like that C7, T1 is just really prominent in people.
Yeah.
More than should be anatomically correct.
Right. Like shoulders like rotated forward too. So those back muscles weaken because they're elongated for long periods of time. So they start getting these knots in them and they get really weak. And so I often tell people, like, hey, if you're going to the gym and you have a desk job, like you should be doing twice as many back exercises as you're doing anterior, like chest and shoulders and things like that, just to help compensate for that imbalance that you're achieving like through the day with your poor posture.
That's a really good point. People don't really focus on their back very much.
Yeah. I think that's a huge one. Like spend most of your time doing that.
And that's interesting though, with changes in bone in Chinese medicine, it's kind of the later stages. And what they say is that there's basically there's a blood stasis, like things can't move. And it gets, at first it's just energy can't move. And then it's like, well, substance starts to not be able to move. And so it makes the body compensate and you get these like knots. So.
Oh, okay.
And then it affects the kidney at that point.
I knew it. I knew the kidney was in there somewhere.
It affects the kidney and the liver at that point. So
that's my C answer, to anything on the test. It's going to be kidney.
It does, though. It's true. It's always the kidney at some point. The end stages of everything are always the kidney.
Yeah.
If you think about like an onion, it's almost always the deepest layer. Like now you start off and the issue's not bad yet. Once it gets deep and it gets bad, then that's the kidney in Chinese medicine. It's like,
gotcha. Okay. That makes more sense that it would be involved a lot with, especially like more pronounced or deeper issues.
Yeah. Almost any issue that becomes really deep and chronic and goes along for a long time, that's going to be kidney in Chinese medicine, among other things. So.
Okay. Gotcha. Okay. Well, anything else as far as just sort of assessment?
No, it's mainly just going to be looking at the tests they've had from their doctors. Most people are going to know if they have arthritis when they come in. Sometimes they won't, but usually they will. Sometimes they don't, and they'll tell you the symptoms. And I diagnose it from my perspective, but then I tell them to go see a doctor. If it's like first thing in the morning, I can't bend my fingers really well. I can't bend them, or I can't move my shoulder really well until it gets warmed up, and then I can start to move it again. It's hurting first thing in the morning. And when it rains, when it's cold, I've noticed that it gets worse, that kind of thing. It's like, okay, you need to talk to your
Yeah. As far as assessment goes, like you don't have to have any special testing done. Most people, like you said, you have some arthritis. You can feel the effects. If you want to, I do generally, have people do x-rays if they can, just to help us kind of track the progression of the osteoarthritis over time. So, let's say you have knee arthritis. We can do X-rays every few years to just kind of track the progression of it. Ideally, it's like we're not going to reverse that, but we can really slow down the progression by affecting the metabolic factors that are contributing to it, correcting some of the musculoskeletal and sort of structural issues that may be going on, and see if we could slow the progression down as much as possible. Which means that you get to keep your joint as long as you can, with the least amount of pain as well.
Yeah. And sometimes, people won't even realize it's arthritis till they get imaging anyways. I mean, I have severe arthritis in my low back, and I would have never known without imaging that, like, oh yeah, like severe arthritis in my low back, some of it's genetic, some of it's because I was a lot heavier when I was younger, and it's a combination of factors, but I would have never known. I just knew like I had pain until I
Yeah.
got imaging, and it's like, okay, now I know I have arthritis, certain things
Yeah.
need to change.
Right. Yeah. It's nice to know how significant it is at some point in time, just so you have a better understanding of how aggressive you need to be too. And sometimes just having that image, having that sort of objective information is enough to sort of trigger someone to really make some significant change in their life to try to slow that process down. So it
Yeah,
can be
and
helpful.
overuse is going to make it worse also. So people can start to adapt. I mean, you still have to use joints, but you can
Yeah.
start to adapt your life to not overuse it any more than you have to.
Yeah, that's a great point. I mean, I see this just as much in athletes who are just like stuck in one sport, where they're like a marathon runner and they don't want to do anything else, besides just running. It's like, well, get ready because, you're going to see more arthritis in your knees and hips later on. Let's try to be more comprehensive and balanced. Let's throw in some resistance exercise, some yoga, Pilates, just some various other types of exercise.
Exactly. Like variety is important. And you're right. When I see people in one particular sport, especially football, baseball, those kind of things, like,
Yeah.
they're going to come in with, really severe issues. Baseball, you're going to get if they're right-handed, the right shoulder, the right elbow, the right wrist, because they're using it constantly for 162 games a year, whatever they're playing. So,
Right. Yep. Right on. Right on. Let's see what else. Labs. So this would have to really go back to the metabolic part. So getting inflammatory markers like a C-reactive protein is a great one to start with.
hmm
Um, Looking at those factors that had to do with the metabolic syndrome. So blood pressure, blood sugar, cholesterol, body fat composition. Those are some good markers to kind of track as well, so that you're looking at those metabolic factors, trying to adjust for those, reduce elevated numbers as much as you can. So again, it's all about sort of slowing that progression down, getting to the root cause. For some people, it may be more metabolic than it is structural, and some other people, it's vice versa. So,
hmm And I'm glad you mentioned CRP. It's a great test. A lot of the research I was looking at for acupuncture and Chinese herbs, that was one of the indicators they used to see change is CRP.
yeah, yeah, absolutely.
Yeah.
Cool. So, what about treatment? What would you do with somebody? Let's say they came in with. So let's kind of do two different scenarios. Let's say you first have someone that's maybe in their late 40s, early 50s. They're pretty small framed, no evidence of like high blood pressure or metabolic syndrome or anything like that. They've just got a
Mm.
lot of wear and tear. They're really active, and they've got some pretty significant arthritis in their knees, in their ankles, in their hips, maybe their lower
Mhm.
spine. What would you end up doing for someone like that?
So, I would definitely do a lot of local points. So, points around where the injury is. So for the knees, I would actually come in from both sides of the knee and go fairly deep. So a lot of acupuncture points are pretty shallow. For
Hmm.
this sort of thing, you want to get as close to the bone as possible. It's not going to hurt. People aren't going to feel it, but you want to get nice and deep because the problem, is deeper a lot of times. And so you want as deep as possible. So you're actually going to go in from the sides and behind the knee. So all the joints you want to hit from as many angles as possible
Okay.
with the needles. And then you're also going to use points on the upper body. So this is weird. I don't know how you would explain this scientifically, but it's part of the medicine. So you do the local points around the area that's injured, and then you do the mirror points. So if somebody has a knee problem, you would do the corresponding points on the elbow.
Really?
Yeah.
Because
Yeah.
it's another hinge joint? Like it's a similar type of joint?
Yeah, they look at it as a mirror in another part of the body. So, like if you're treating the knee, you would also treat the elbow because it mirrors it. If you were to look at the body, it's kind of an opposite mirror.
Okay. All right.
So it's part of the medicine. So you would do those local points. I would do the distal points on the upper body, and then I would also do some ear points because it works on a lot of the nervous system stuff.
Okay. Okay.
Yeah,
Interesting.
and then also if it's osteoarthritis, a lot of times, not always, it tends to be worse in cold, damp weather. They'll
Yeah.
notice it more, and that's when you put a heat lamp over it too. You want to keep it nice and warm. That's where heat becomes a really good thing because it's not acute inflammation usually.
Yeah. Yeah.
So I like heat in that case.
Yeah. There's a reason people want to retire to Arizona and Florida, where it's going to be warmer.
Yeah, you don't hear a lot of people say, "I want to retire to Fairbanks, Alaska."
Yeah, that's true. Yeah. The arthritis doesn't do as well there. Yeah, absolutely.
And then also there's some Chinese herbs you can do,
Okay.
depending on the type of arthritis. And it's not like just osteoarthritis. It's like, is it something that tends to move around a lot, or is it something that tends to be, heavier, more stiff, or is it more painful? And
Okay.
based on that, you would decide which formula that you would do. So it's pretty
Okay.
cool though. It's like, and that's going to be about the same for everyone. And there's a really good Chinese saying they use for arthritis. It says, "Running water does not become stale," and that means like for prevention, making sure that you have active movement without overusing.
Oh, I
Like
like
if you're
that.
sitting all the time, if the water is not moving, it's going to become stagnant. And the same thing
Ah,
with your body. So getting people to move in a good
yeah.
way.
Running water doesn't become stale. That's great. I love that. Huh.
Yeah. So how
I'm
about
going to
you? What
use
would
that
you
with
do
my
if somebody comes in,
kids.
same patient?
Yeah, this kind of scenario I love because to me, it's pretty simple. It's pretty straightforward. There's likely not a lot of metabolic underlying issues going on. So we can just treat the structural stuff. So, first, correcting any structural issues that they may have, whether it's posture, in muscle imbalances, weakness in certain areas. That's pretty straightforward, simple. And then for these people, I love doing injection therapies, like doing visco supplementation, which is like injecting hyaluronic acid in, which is like a lubrication to the joint. And people
Oh,
can
nice.
literally walk out feeling better, and less knee pain, like instantaneously with that.
Ooh, that's nice.
The other thing I'm starting to do a lot more now is called prolozone, which is a combination of prolotherapy, which is injecting a solution. Usually, it's a sclerosing agent like a dextrose. Some people use like different anesthetics like procaine and other, throwing some nutrients in there like B12 and some other B vitamins, things like that that can kind of create some nutritive value to the joint, but also a little bit of inflammation. So the joints are tricky because they're typically avascular, so they don't have blood flow directly to them, and which is why they can take a long time to heal or
Hmm.
repair from an injury. So if we can give it a little bit more of a nudge, an inflammatory process that can kind of help migrate more stem cells and more growth factors to the area that can help them recover a little bit better, more collagen synthesis, things like that. And then we follow that with an injection of ozone into the joint. So
Hmm.
usually, if you're talking about a joint like a knee, we can do 5 to 10 cc's of ozone into that knee, and it's really kind of funny because there's not a ton of space there, so the knee will start talking to you. You'll hear a lot of crepitus after injecting the air until that ozone sort of dissipates. But injecting ozone does a couple of things. It creates a controlled burn. It's like a fire inside a fireplace versus a forest fire. If we can have a controlled burn and create a slight inflammatory process, but at the same time oxygenate an area that is avascular, that doesn't have a lot of blood flow and oxygen to it, then again, that can sort of expedite the healing process. And I've seen tremendous results with the prolozone. It's been absolutely amazing. So I'm using it more and more in those particular cases.
It's interesting you mentioned the inflammation, because I think that isn't all what's going on with acupuncture, but it's definitely part of it, because you're going really deep in these points around the joint, and you're actually sometimes wanting to hit the bone. It's called bone tapping.
Yeah.
And that actually makes a lot of sense, because that's going to cause kind of a local inflammatory response. So
yeah, absolutely. All right. So if we had another type of patient come in who is, let's say obese, they may be in their 30s and 40s, a lot of other stuff going on, high blood pressure, maybe sort of pre-diabetes, a high cholesterol, all that. I mean, metabolically, they're kind of a mess. And let's say they have the same thing, kind of knee pain, some mild to moderate arthritis. Would your plan change at all with that person?
for sure. I mean, I would still do the local points, because I mean, they're coming in for pain, among other things. I'm going to treat the pain, but I'm also going to work a lot more with kind of general points, more of the general points that I would do for blood pressure, for blood sugar. I spend a lot more time talking about lifestyle stuff and, healthy movement, because you definitely want them moving. A lot of people think, well, I have arthritis, I don't want to be moving. It's like, no, you want to do healthy movement, not no movement. So I would definitely look at more systemic points along with the local points. I would look at making sure they're, working on being active, making sure their food's good, their stress, their sleep. I would refer them to a naturopath or somebody who could help with that side of things if they don't want to listen to me about it, because I happen sometimes you need two voices for people to listen, or three voices.
Yeah, that's true.
So yeah, that's kind of how it would change. And, herbs are going to become more important for this kind of person too, because you can really focus on a lot of the internal stuff with herbs.
Yeah.
And so, and this is funny. You'll get a crack out of this. There was an ancient formula for arthritis called Huo Lo Xiao Ling Dan, the miraculously effective, invigorating, connecting channels pill. So they named it after how awesome it is.
That's great. I love it.
So yeah, I give them that. The patient's going to get it, because it's miraculously effective.
Yeah, absolutely. That's
But
awesome.
yeah, I would definitely focus on a lot more than just local, though. That would be, and a lot more of what they can do at home. How are they taking care of themselves, that sort of thing.
Right.
How about you?
Nice. Yeah, so I'm with you there. I would still do the localized treatment just like the other patient, but obviously working on the metabolic stuff a lot more. So, these are people too. Like, yeah, we can work on blood pressure and blood sugar regulation, trying to get them to lose some weight. Just structurally taking pressure off of that joint can be helpful. But this is an area where we can start with nutrient therapy, some supplementation, herbs, and things like that can be helpful. This is probably one of the areas that I find people can get kind of crazy with the supplements. All the glucosamine and chondroitin and
Oh yeah,
MSM,
that's true.
taking
That's true.
$200 worth of supplements, every month. They're not doing the structural or metabolic stuff as well. So all those supplements can be useful. On a side note, if you're doing glucosamine and chondroitin, do the sulfate form. Don't do the hydrochloride form, which is going to be the
really?
cheapest, version of that. All the really good studies were done on sulfate. You need that sulfur component to really help. That's why MSM is so beneficial too, because it has that sulfur component in with it. So just kind of a side note there. But if I see someone come in and they're taking all these supplements for their arthritis, but they're not doing the basic stuff like working on their blood sugar and trying to be active and trying to correct some of the structural issues, the supplements are just going to be minimally, if effective at all.
Yeah.
So I really don't like jumping too far ahead with the supplements right away. But I will say, there are some pretty significant connections to sort of diet and certain nutrients when it comes to osteoarthritis. Like take sodium for instance. Now you wouldn't necessarily associate sort of a high salt diet with the more sort of progressive arthritis, but we're seeing that in studies. One was done on women who consumed a high salt diet. Now, this was really high. We're talking 9 grams of sodium per day, which
Wow.
is, yeah, that's about 4+ times how much you're supposed to be taking in. But it's not uncommon to see that high salt in people because of all the processed foods that we eat. Anyway,
Mhm.
they lost 33% more calcium and 23% of a particular type of protein called hydroxyapatite, which is part of the bone, on versus people who were on a moderate salt diet, which is about 2 grams per day. So just by having a higher sodium intake, they lost more calcium in these bone proteins, which obviously, if your bones are breaking down at a higher rate, your arthritis is going to be more progressive. It's going to be more substantial over time if you can't build good bone. So sodium is a big part of that. Um, Another one we looked at was NSAID use. So this is another big one too. People can get in this habit of if they've got a little arthritis, they have some pain, so they start popping the ibuprofen and naproxen, things like that. What we see with that is there was a study done several years ago where they sort of did a head-to-head with ibuprofen and other NSAIDs versus some herbal anti-inflammatories like turmeric, boswellia, some that are pretty typically used for arthritis. And what they found was there was this sort of overlapping at about 12 weeks where the NSAIDs worked much better on pain and inflammation for the first 12 weeks, and the herbs were kind of down here. But at about the 12-week point, they see those two lines converge. And after that, they actually see the herbs working better and they see the NSAIDs working less, where people actually had to take more, like a higher dose of the NSAIDs to be effective. And
Interesting.
I've seen that in practice myself too, where it's like, NSAIDs are great for short-term flare-ups, but you don't want to depend on them long-term. They can actually, there's some evidence they can make it worse because they do inhibit some collagen synthesis. And remember, collagen makes up all that connective tissue in your joints. So by inhibiting that, you're slowing down that repair process, especially
Hmm.
if you're doing it long term. So that may be part of that downward, curve that we see at that 12-week point. But the herbs don't have that same effect because they're not as strong as the NSAIDs, but they still do have a really good anti-inflammatory effect. It just takes some time to see that effect. So by the 12-month mark, they saw a significant difference between pain levels in the herb group versus the NSAID group at that point. So anyway, kind of interesting to see.
That's really interesting too, because it really goes to what like our culture now is very much like you want the pill that works right now.
Yeah.
And I think that's one of the biggest struggles with treating arthritis from my perspective. And I actually do have something I can give people that treat it right now. Evil bone water. It's a topical that you put
I
on.
love that. Yeah.
It's amazing. It was specifically for external issues, but it's terrific for arthritis. It's one of the main conditions it treats is arthritis. But the
Yeah.
problem is that because it works so well, you run into people who are just like, I don't want to get help at all. I just want to slather this on 4 times a day forever.
Right.
So,
Yeah.
so I think that it's important when things do work well, like your shots or anything else, the evil bone water, like making sure that people still know, like, okay, but we still have to treat the root underlying stuff because it's just going to be an ongoing issue. And I think
Yeah.
some of that's, our culture is just the way we think now. Why wait 12 weeks for an herb when I can pop ibuprofen right now and get relief?
Yep. Yeah. I mean, we're a fast food mentality type of country. Yeah.
Yeah,
We
12
want
weeks is a long time, right?
it is. Yeah. Right. I mean, the grand scheme of things, no, but yeah, in modern, time, absolutely. It's an eternity to kind of wait for something to kick in. So I get it. But knowledge is great. Just having that awareness that it can play out that way can sometimes change behavior. That's what we're shooting for.
Yep, exactly. And I still give them the evil bone water because it works great, but I also work with it with other things. And you could still give them the shots and it works great. And you're still working with them to make sure that you're helping both in the short and the long term, which is the goal.
Yeah. Yeah. I mean, my typical sort of protocol is put them on the anti-inflammatory herbs and then tell them, hey, when you have a flare up, use the ibuprofen or the naproxen for a few days until you're back to sort of normal, and then continue the herbs because you're gonna get the benefit of both, right?
And I'm glad you said that because a lot of people think natural doctor or naturopath, they're going to think like, oh, they'll never tell me I'm allowed to take meds ever. Like they're
Oh,
anti-medication.
yeah. No, it's about the best medicine, right? And sometimes that's a medication. Sometimes it's an ibuprofen. It's we've got to think short term and the long game here. And sometimes we need medications to kind of get us through a period of time until the habits that we need to form and sort of those lower interventional things like the herbs give it time to actually kick in and start to to work, right?
Yeah.
And that takes all those things take time. And most of us, in order to create some momentum and movement the right direction, we need to start seeing some progress. We need to see some movement in whatever we're trying to work on. And sometimes the medication or the NSAIDs, things like that, help provide that. They just help provide a little momentum, a little reprieve, so that we can get in a good headspace to continue on and start doing the things that we know are going to benefit us in the long run.
Yeah. And you're right. Absolutely. And you were talking about a study. There was actually a study in 2000 looking at a Chinese herbal formula versus methotrexate for rheumatoid arthritis. And it actually found in the long term, the Chinese herbs were significantly better for decreasing pain and inflammation and CRP in studies
Wow.
than the methotrexate, and it decreased elevated ESRs also.
Really?
So, but it took time. Like it was
Yeah.
this study where they had to take it regularly, but this herb
Yeah.
was shown to be that effective, and they have like the blood test to back it up.
Yeah.
But if you were just taking the meds, it's like, well, what worked most immediately? It's probably methotrexate. It's like
Oh,
immediate.
sure. I mean, that's super strong. It's going to, really calm your immune system down. But that's really interesting that the inflammatory markers were better in the long run using the Chinese herbs. That's
Yeah,
fascinating. I love it. Yeah.
yeah. But anyways, I know we're not talking about rheumatoid arthritis, but it does go with the point of making sure that you're looking at the long game and knowing like, okay, I can help this over a long period of time.
Right. Yeah.
Yeah.
Yeah. I completely agree. I think I'd do it some injustice if I didn't throw in some comments about vitamin D and vitamin K. Um, yeah, these are super important. I mean,
Even if you're
everywhere
in the
I look,
South, even if
yeah,
you're in the South.
everywhere I look, people are. I mean, I have family members that live in Texas that are vitamin D deficient. Like, how is that even possible? But it makes sense. Like in the summertime, nobody goes out. It's like Fairbanks in the winter. Nobody goes outside, right? Or for very long, especially enough time to make some vitamin D in their skin, or they're slathering on the sunscreen before the sun even hits their skin. So we're seeing definitely epidemic levels of low vitamin D, and this sort of discrepancy in like what is a healthy vitamin D level. And there's a pretty big range of 30 to 100 is sort of the typical lab range that you're looking at. So if you're at a 32, that's technically normal. But in the literature, we actually see the level around about 50 to 80 is where we see significant reduction in just a number of things. And that includes arthritis, type 2 diabetes, even certain forms of solid tumors, cancers, especially like breast cancer. There's a really big correlation between vitamin D levels um, and breast cancer incidence. So there's just tons of stuff. Autoimmune conditions, particularly like MS. We see definitely a distinct correlation between vitamin D levels and those autoimmune conditions. So that's my goal, is to try to get people between about 50 and 80. Not all doctors or health providers are going to agree with that. But if you don't, I just encourage you to actually look at the research around this. It's pretty significant. We actually did. I think you were part of this, Mike. Several years ago in Fairbanks, we did a big vitamin D initiative, right?
Oh yeah.
Because as a big clinic, we were like, hey, how can we best serve our community? Like, what if we were to do something community wide? What would be the thing that would really move the needle the most? And we ended up coming up with vitamin D. And so for several months, it was our goal to educate, people about vitamin D, what it was, and the significance of supplementing with enough vitamin D and tracking your number and all that kind of good stuff. So we would go out and we would do talks to Lions Club and Chamber of Commerce and whoever would really listen at that point, and give away free bottles of vitamin D. Like, we were all in as far as trying to create a really good community movement. And, it was really interesting. That was years and years ago. I still have patients occasionally bring that up and say, hey, I remember when you did this talk at my school or whatever about vitamin D. And I remembered that. And I've been tracking my numbers. And now, all these kind of things and weird stuff and symptoms and things started to resolve or get better after I started taking enough vitamin D. Yeah, it's a pretty significant thing, not just with arthritis, but a ton of other, issues.
Thanks for the reminder. I need to start taking my vitamin D again. I've been slacking.
Right?
I've been slacking on it.
And just a side note on vitamin K2, this is another really important one for bone health.
K2 or K also?
K2, the number.
Oh, K2, not K2.
Yeah.
Okay.
So there's K1 and K2. Both of them are really important, but K2 more so when we're talking about preventing bone loss, which obviously is going to have a factor in osteoarthritis. But when you're taking higher doses of vitamin D, one of the things you have to kind of watch for is high calcium levels, because vitamin D helps your body absorb calcium from your diet. So if you got a ton of calcium in your bloodstream, that could potentially be an issue in multiple ways. One, you could form more kidney stones. And nobody, trust me from experience, nobody wants to go through that unless they have to. That's just horrible. I've got so many stories. It's bad. Anyway, so kidney stones, and then also you can use that calcium and lay it down as far as plaque formation in your arteries. So one of the things we do is we look at a coronary calcium score, which is a picture of your heart blood vessels, and we look at how much calcium has actually been laid down in those blood vessels. So obviously we don't want that calcium to be in your blood vessels causing atherosclerosis and all that kind of stuff. One of the things that K2 does is it helps direct that calcium out of your bloodstream into your bones. So it's putting calcium exactly where we want to see it and taking it out of the bloodstream. So that's a great benefit of K2. Most people, K2 is not even on the radar. So especially if you're taking D3, you're going to want to make sure that you're taking some K2 along with that, especially if you're doing high doses. Like for me, I have this vitamin D SNP, this mutation that makes it to where I need a higher dose of vitamin D than most people. And I didn't truly understand the concept of the calcium and vitamin K2 initially. And as my vitamin D levels were going up, my calcium levels went up too. And I got kidney stones. And boy, I learned my lesson pretty quick there. So the K2 made all the difference in the world. I rarely ever have them now unless I get super dehydrated. So
scale of 1 to 10, how painful is a kidney stone?
Oh man, it's just I think it's for guys, it's about the closest thing we can get to birthing a child, that just the experience and the pain involved. Now, ladies, I'm not at all trying to say that's anywhere close to childbirth, but I feel like as a man, that's probably about the closest thing we can get to it.
That sounds unpleasant. I'm going to avoid that.
Yeah, please do. All right, man.
We went almost an hour again.
What's that?
So we went almost an hour again.
I know. Time flies. Anything else you wanna drop before we let go?
No, I think the biggest thing is just making sure that people know, yes, get some help. a lot of people know they have arthritis, but they don't actually do anything about it. Like, go talk to an acupuncturist, go talk to a naturopath, or at least do some lifestyle stuff to actually pay attention to it.
Yeah. Yeah. And just try to get away from that mentality that, oh, it's just wear and tear. I'm just going to focus on that particular joint. Because, if you've got some arthritis in your knee that you're actually feeling, you have arthritis other places too. I guarantee it.
Mm-hmm.
And so you're going to need to implement other strategies to try to slow that down as much as you can.
Absolutely. I agree.
All right, man. Always great.
Good talking again.
Yeah. All right, guys. We will see you next week. Take care. Be healthy.
See you soon.